I was listening carefully to the comments made by my colleague from West Virginia, and I thank her for coming to the floor and expressing her feelings about the Affordable Care Act. It is truly an article of political faith on the Republican side that we must repeal Obamacare. We've heard that for 6 years, maybe longer. And each and every time, Democrats have said, and then what? We've asked Republicans, what would you replace Obamacare with? And until some of the most recent moments, there was never an answer. Now they are starting to put at least some ideas forward. But I will tell you, repealing Obamacare and then talking about the possibility of replacement is a disaster. It is an invitation to uncertainty and chaos. You might expect that from a Democratic senator who voted for the Affordable Care Act, but what I ask my colleagues in the Senate is, please go home. Please go back to your states. Do as I did yesterday. I called together the administrators of hospitals in central Illinois, small town rural hospitals and larger hospitals, such as Memorial Medical Center in my hometown of Springfield. And I asked them in a non-pressurized setting, what would you do? What's wrong with the Affordable Care Act? How would you change it? What would be the impact of repeal? I knew, and they did as well, that there have been some reports from the Congressional Budget Office. Just last week, the nonpartisan Congressional Budget Office told us exactly what repeal without replace would look like. 18 million Americans would lose health insurance in 12 months. 32 million within 10 years. Premiums in the individual health insurance market, according to the Congressional Budget Office, if you went through with the Republican repeal plan, premiums in the individual health insurance market would increase by 20 to 25% in the first year and double within 10 years. Despite this, on his first day in office, President Trump signed an executive order that began to dismantle our health care system. We still haven't seen the president's secret replacement plan, even though he's repeatedly said that he wants to replace the law at the same time he repeals it, and we're going to be so proud of what he does. Well, let's talk about what repeal without replace means in Illinois, now that I've taken it home and asked the people who are actually running the hospitals. More than 90,000, with repeal, 90,000 young people in Illinois would be thrown off their parents' health plans. More than 7 million Illinoisans with health insurance through their employer would once again be subject to discriminatory health insurance practices like discrimination based on pre-existing conditions, annual and lifetime caps on coverage, and discrimination against women. In my state, the Republican repeal plan would have an impact statewide because insurance plans statewide could once again decide not to cover maternity or newborn care, mental health, or substance abuse. Those things are required under the Affordable Care Act. That would be removed with its repeal. In my state, more than 1 million people would lose their health insurance. In fact, 1.2 million to be exact. And according to the Illinois Hospital Association, my state would lose $11 to $13 billion in annual economic activity with Republican repeal, translating to the loss of up to 95,000 jobs. And let me tell you about those jobs. In towns like Taylorville and Pana, Illinois, near my hometown of Springfield, those are good paying jobs. Sometimes they're the best paying jobs in the community. Those would be the jobs lost by the Republican repeal of Obamacare. For years, we've been hitting back against misguided and misleading claims about the Affordable Care Act. You know who's hitting back now? Hospitals. And not just hospitals. Healthcare providers across the board are pleading with the Republicans. We know you have some campaign promise that you want to keep, but keep first your promise to the people you represent to provide quality, affordable health care. Senator Tammy Duckworth and I have sent letters to every single Illinois hospital, over 200 of them, asking about the impact of repealing the Affordable Care Act without enacting a replacement to prevent total chaos. Just yesterday morning, when I met with these hospital administrators, I heard firsthand. I met at Memorial Medical Center in Springfield, Illinois, Representatives from Hopedale Medical Center, Pana Community Hospital, Carlinville Area Hospital, and Warner Hospital and Health System. Memorial Healthcare System is a nonprofit, community-owned healthcare organization. When I asked about the impact of repealing the Affordable Care Act, here is what they told me. Repeal without replacing the ACA would adversely impact patient access to care and our hospital and health system's ability to continue to provide services, as well as potentially result in job losses. They went on to say that Memorial Medical Center in Springfield, with Republican repeal of Obamacare, could lose over $140 million over the next 6 years, and that uncompensated care costs would, quote, rise dramatically due to both a rise in charity care and decline in Medicaid coverage and reimbursement. They cautioned me, quote, we would be forced to cut spending by reducing services, reducing staff, delaying investment in new technology and facility improvement. Losses of this magnitude with repeal of the Affordable Care Act coverage simply cannot be sustained and would adversely impact patient access to care and our hospitals and health systems' ability to continue to provide services. This is not the only hospital that's telling me this in our state. I'm from downstate Illinois, proud to represent Chicago, but I've represented in Congress and in the Senate, small-town rural America, communities where the hospital makes a difference. If you don't have a hospital nearby, you could be an hour's drive, if you're lucky, from quality medical care, not to mention the impact that hospital has on the local economy, keeping and attracting new businesses. According to the Illinois Hospital Association, the 15th Congressional District in Illinois stands to lose $470 million under Republican repeal of the Affordable Care Act. That means 3,400 jobs lost in that congressional district in central Illinois with repeal of affordable care. Now, we talk about good jobs and creating them in the state. The president goes and makes trips, as he should, to try to save American jobs. And yet the first congressional action by the Republican majority this year is to threaten 3,400 jobs in the 15th Congressional District. Washington County Hospital in Nashville, Illinois, is a 22-bed critical access hospital 50 miles from St. Louis. They provide acute care, surgical service, gynecological services. When I asked them what Republican repeal of the Affordable Care Act would mean to Washington County Hospital in my downstate area, and they said, quote, to eliminate the ACA would be detrimental to the thousands of people in our county that were previously uninsured, either because of part-time work or serious health problems. They went on to say, I guarantee that repealing the Affordable Care Act without a strategic health care replacement plan will result in more downsizing and staff reductions at Washington County Hospital. Our community cannot continue to lose these good-paying jobs, and I believe our county residents will continue to move to neighboring states with more favorable job markets, better job security, and stable benefits. They ended their response with this warning, and I quote, I truly fear, the administrator said, that many Illinois communities will lose their critical access hospitals, the only sources of health care in many of our rural counties and a vital part of infrastructure. Quote, as you know, our rural areas have vulnerable populations of elderly folks that have many chronic health care needs, limited ability to travel long distances for emergency care. I sincerely hope that you heed the warnings of our physicians and hospitals. Do not repeal the Affordable Care Act in a hurried political rush. Washington County is not a blue county. It's not a Democratic county. It's a county that votes regularly for the other party. It is a conservative voting populace representing a lot of farmers and small businesses, and this is their hospital administrator warning the Republicans here in the Senate and the House, be careful what you do in eliminating the Affordable Care Act. According to the Illinois Hospital Association, the 16th Congressional District in Illinois stands to lose $453 million under Republican repeal of Obamacare, and that means a loss of 3,300 jobs. Swedish American Hospital in Belvedere, Illinois. Now that's in the northern part of my state. That medical center provides health care to Belvedere, Boone, Western McHenry, and northern DeKalb counties. When asked how the hospital has fared since the passage of the Affordable Care Act, the administrator at Swedish American said, quote, "The passage of the Affordable Care Act has afforded our health system with significant benefit related to compensation of patients with uncompensated care. Swedish American experienced an average annual increase of $43 million in Medicaid payments and a $10 million reduction in uncompensated care." When asked about the impact of the Republican repeal of the Affordable Care Act, Swedish American Hospital of Belvedere, Illinois said, quote, "The impact would be significant. It would create an unsustainable financial result, and we would be forced to make significant reductions in staff and curtail future plans for capital expenditures." Yesterday at my roundtable in Springfield, I asked some of these hospital administrators, well, what's wrong with affordable care? And they told me, and let me add quickly, I believe as they do. There are things which need to be changed in that law. It's not perfect by any means. They talked about the cost of care, and they should. In some areas, premiums have gone up too quickly, and the availability of insurance is not as it should be. I've talked to the health insurance companies, including the big companies like Blue Cross Blue Shield. They've told me specifically the method of enrollment now under the Affordable Care Act leaves loopholes for people to jump in and out of coverage as they need it. You can't run a viable insurance risk pool if people are only forced to sign up when they're facing a healthcare crisis. You have to have healthy people paying premiums to cover those who get sick and need to be compensated. So there are things certainly within the Affordable Care Act which need to be changed, and these administrators told us. So I said to them, well, I hear commonly from my Republican friends, if we would just allow people to buy health insurance over state lines, there would be more competition. They laughed. And they said, you mean to say if you heard that there was a health insurance plan in Alabama and you lived in Illinois, that you would buy health insurance there? Is that the idea? I said, I suppose. I hear it over and over again. If we could just buy policies across state lines. And they laughed at it. They said, you know what's going to happen? You know what happens when you buy insurance in Illinois and they tell you the hospitals and doctors that are eligible? Well, you certainly want to have doctors in your home area eligible who may not be eligible under an Alabama plan. That makes sense. And secondly, they said if people outside the state start buying into Alabama who are truly sick to get lower premiums, the premiums are going to go up. They're going to engineer the risk pool to make sure that it's viable. So that is a notion which they rejected out of hand. And I asked them about health savings accounts. That's another thing you hear over and over again. If people could just set aside non-taxable income and leave that in a pool of money to pay their co-payments and other expenses, then there would be a disincentive to overutilize health care. Well, these administrators said, but people who are living paycheck to paycheck don't have money to set aside, even non-taxable money to set aside at that point. And ultimately, many of them would put off care that they desperately need until they become even sicker. So each one of these approaches has its critics. There are people who think we ought to look at it more carefully. I think that ought to be the bottom line. To my Republican majority, look at this carefully. It isn't a matter of keeping a campaign promise. It's a matter of keeping a promise to the people you represent, not to leave our healthcare system in chaos. I hope President Trump and my congressional Republican colleagues are listening to what my constituents back home told me yesterday, things that they will hear themselves if they'll go back home and listen to people who run the hospitals in the communities where the voters that they represent live. I'd like to conclude with a quote from Dr. William Gorski, President and CEO of Swedish American, on the subject, who wrote to me and he said, I must also speak forcefully as a former practicing physician, irrespective of any financial impact of repeal, real lives are at stake here. President Obama's vision recognized a great understanding of the importance of healthcare access to the quality and outcomes of care. Any diminishment of this access threatens the health and well-being of millions of our fellow citizens. My strong view is that rather than repealing the ACA, We should be looking for ways to refine and expand it. That comes from a doctor. I solicited his view. I don't know him personally, but it represents the feelings of many. I ask consent that the State Journal Register article from Springfield, Illinois, on my meeting yesterday be placed in the record after my statement.
Without objection.